My name is Norm Hess. I'm the Executive Director of the Michigan Association for Local Public Health. It is a statewide association that includes members from all 45 of Michigan's local public health departments.
Today we're interviewing Norm to talk more about the LHD Academy of Science and how we serve our members across the nation. For those that don't know the LHD Academy of Science, we are a member organization made up of 450 local health department data collectors. We are found in 9 states, and the purpose is that before organizing, all of us would collect all of our measurements across all these variety of survey platforms. SurveyMonkey, RedCap, Qualtrics, Survey Gizmo, and they would be hidden across all of these logins. And for every one problem, we would be creating 3,585 unique measurements, and that was a problem. And so 50 local health departments came together originally a couple of years ago and said, why isn't there an association that is coming forth to be the holder of the public library of measurements for local health departments? So the goals and phases of the program that you're going to be learning about today are, number one, let's come together and purchase a survey software for all members. This would reduce costs significantly, but it would also make it so that we were in the same code so that we could trade measurements like baseball cards. Number two, it would create a state level librarian where we could organize all of these measurements across each state so that they were accessible to all of our members and reduce the ability of having to recreate the wheel. And then third, have a national level librarian so we could see what other states are doing. Without further ado, here's the interview from Norm and how he supports the LHD Academy of Science. What's your AOS story? Like, how did you get involved? When did you first hear about it, and why were you saying, hey, this is something that we should be involved with?
Right. So I have been with MALPH, is what we call ourselves, for about 2 years now. And shortly after I started, one of my staff said I needed to connect with Jake because he was starting this project that would help our local health departments pull together survey data and to be able to store it in a standard place. And it just sounded like a great idea to me. One of the things as an association that we always try to do is to find ways that our local public health staff can work more effectively and efficiently. The Academy of Science has helped us to find ways to reduce duplication on the part of our data collectors throughout the state as they look to collect data that is very similar to other health departments, but may not have access to those measurement tools. So before the Academy of Science, we saw a lot of duplication. We saw many circumstances where our data collectors in local public health departments were creating very similar tools, but using different language and having to recreate every time someone left the health department. And the person coming into the position didn't know where to find those things. So one of the great advantages has been that now folks are directed toward the shared library, and they know where to find items for various topics.
The Academy of Science has many values, one of which being measurement transparency. And before we organized, health departments were creating all of these measurements in random logins and hiding them from each other. However, now we believe in every time a member creates a measurement, we should make them transparent and available and shareable to all health departments. Why is taking that step and making it transparent important to MALPH and its members?
My sense is that in Michigan, it wasn't so much that people were reluctant to share, they just didn't have a platform or a place to do it. And so as they created things, they would do it under their own login. It would be on their own, the whatever drive that they save things. And then when a person left, all that information was lost. So I think that our members really value the ability to share these things and to be transparent and to discuss and to critique and to make the measurements better through our monthly meetings.
AOS looks for ways in which the measurement library can strengthen the collective work and support state associations. Why do you believe that there should be a statewide library of measurements to standardize?
I think it just makes sense for local public health departments who are creating measures and tools around similar topics to be able to store them all in one place. And I think that in many situations like ours, it totally makes sense for the state association to be that convener, and to facilitate conversations across districts. We do that in many different venues and avenues and topic areas. And I think that this is just a natural extension of the other work that we do.
AOS is technology independent, meaning we're committed to using the best technology for data collection, but we safeguard against technology practices that would silo our collective work. Why is it important that a technology company not own these measurements or monetize these, but actually they be free and available to all members?
So local public health departments often do not have a large amount of money set aside to pay for these data collection efforts. Within Michigan, some of our health departments have epidemiologists. Others are using other positions to collect information for their community health needs assessments and screening tools and other things. And so it is important to us that these be available and accessible so that it reduces the barriers to our people who are trying to get work done across the state, sometimes with very limited resources.
Measurements. Why is it important that we come together as peers and try and improve the debate instead of just hiding and going along our way and measuring differently?
Well, we would like to have information that, as much as possible, tells the same story in one part of the state as it does in another, at least that the conversation is the same. And with our group, it is very encouraging to see as the months go by and we keep holding meetings, how people are willing to open up and to share their measurements and to have those talked about and critiqued by their peers. And I think that it's a wonderful way to train people to become better data collectors, as well as to improve the quality of the data that is being collected.
Reducing measurement duplication. AOS members, we strive to reduce the overall number of duplicate measurements that exist in a local health department. For a common citizen in Michigan, maybe you want to talk from an angle of just as a citizenry. If I move from one health district to another health district to another health district, and they're redundant measurements, but they don't speak the same language, how hard is it for the average person to engage health data if it's not standardized? Like, why should we as a state be committed to that and committed to each other?
It's very important that the data be collected in a standardized way so that the general public can understand it, and our legislators and policymakers can understand it. We don't want to create information that can only be understood by people who have a master's degree in epidemiology. It needs to be accessible and understandable to people who are making decisions within their communities, or even making decisions about where they want to live and what activities they want to take part in. And as a publicly funded government entity, it is incumbent upon a local health department to make the best use of resources that they have. So we encourage our local health departments to use the information that they gain from the meetings that we have every month, the measurements that are in the library, so they can be good stewards of the funding that has been given to them. We don't want people to recreate new measures that really serve no purpose if they have already been established.
Every health department matters. When AOS was founded by the 50 original pioneering members, they could have easily, especially the largers, the Ottawa, the Macombs, they could have easily grouped around the country with the halves of the health departments and moved forward towards standardization, but they didn't. A core value was that every health department matters, and we worked towards buying in bulk, going towards state grants or CDC grants to make sure that every local health department mattered and was at the table. Why is that value important to MALPH?
Jake, I think that it is important for all health departments to be involved. And I think that many times it is our smaller rural health departments who are really able to gain the most value from a project like this, because they don't have epidemiologists on staff necessarily. They do not necessarily have the same level of training in survey development. And so this has just really been a boon to their success in being able to rely on their larger health department colleagues across the state, and to be able to have conversations with folks who may have more experience and have done more of this work. So I think the local health departments in rural areas and in underserved areas are really taking advantage of this unique opportunity to improve the work that they do and to serve their constituents better.
AOS has always formed an AOS buying committee and followed the guidelines set forth by the National Institute of Government Procurement in having our members select the software that we use. Why is it important that we do a competitive process and allow our members to decide what tool it is that we standardize on?
Good question. It's important for the end users to really have input and buy-in to the process of procuring the software, because in other experiences that I've had, the users, the daily users, were not necessarily actively engaged in the conversations before software was acquired. And then after the license was bought, all of the issues and preferences started to come out. And so some folks then in that situation just will use what they were using before, and the whole project won't be quite as effective. We have some folks in Michigan who are quite excited to serve on the procurement committee so that they can express what they like about the software that we're using and improvements that might be available down the line.
If you had a chance to talk with other state associations or national associations, NACCHO, CSTE, or even the CDC, why would you say to get involved in this movement for the greater good in standardizing local health department measurements?
From my perspective, there really is no reason not to get involved in this AOS project. I think that it makes sense for local public health departments to come together and their state affiliates and national partners to really continue to grow this library, to standardize the measurements, and to tell the story about public health in a way that can be understood by people with all different backgrounds and levels of exposure to what public health is. It just is, it's very important for the field of public health to come together and to speak the same language, to collect data in the same way, to construct the story of our successes and, areas that need to be improved. And I think that AOS is an excellent way for us to do that as a field.
Thank you, Norm, for the interview, and to all the other state associations that support this effort. We couldn't do it without you. We also want to say thank you to all the state health departments out there that also support their AOS groups in their state. And if you're an AOS, if you're not an AOS state with a group or a state association that's not supporting a group, we'd love to talk to you. We'd also, if you're within the CDC, like to talk to you about this growing movement, as we know our local health department data collectors would love your support as we start to go across the nation and to build a public library to meet their needs. Thank you.